I want to elaborate on what I said in my last video when it comes to fertility testing, specifically doing an ultrasound to look at the uterus. So let me start by orienting you. This is a transvaginal ultrasound image of a uterus. You see the thick muscle layer that makes up the uterus, the inner cavity here. This is the cervix. And then going to the top of the uterine cavity, you see this line here. That's the lining that we sometimes measure the thickness of. And right now you don't see anything inside the cavity, right? It's a collapsed space. And so there could be any number of things hiding in there that you're only going to see if you do something to push the walls apart. This can be a little confusing to anyone who doesn't regularly look at ultrasound images. This is not that triangle-shaped uterus that people are used to seeing in a textbook. That's actually on its side, and this is the bottom, and this is the top of the cavity, and the uterus is this thick muscle here. So we're essentially getting a side profile view. You could do a 3D ultrasound where you'll be able to see the triangle, but in this view, this is a side profile. When we perform a saline sonogram, we put a catheter through the cervix and we put some fluid to push the walls apart. And you should get this clear view, but you see these interruptions where there's a connection between one wall of the uterine cavity to the other. That signifies scarring, adhesions, or Asherman syndrome. And the cavity is interrupted and constricted by the scar tissue, which you can see in certain parts of the cavity as you sweep the ultrasound probe from one side to the next, and you really get a full survey of the uterine cavity. Now, had we not done this saline sonogram, those adhesions, those pieces of scar tissue could have just gone unnoticed. So anytime someone's talking about looking at your uterus, make sure there is a specific assessment of the uterine cavity, which can be done in one of three ways. Either a saline sonogram, just like this, with fluid, or an x-ray of the pelvis called an HSG or hysterosalpingogram, where an x-ray is taken and there's dye that lights up on the x-ray that you can see fill the uterine cavity. Or you can take a direct look by doing something called a hysteroscopy, where we put a camera through the cervix and look directly into the uterine cavity.